Imagine that you live in Sweden. You have the highest taxes in the whole world. An average person who earns about $3,000 a month in salary pays about $2,000 of that in tax. An insane amount of tax. This is socialism, folks. So you would expect some extremely good health care, no? I mean, when you pay this much tax, with socialized medicine and all this socialism, you would expect some fantastic healthcare, but that is not the case. There's currently a massive problem in Sweden right now with the hospitals. In fact, 30,000 patients have to wait more than 90 days for an operation. And many hospitals in Sweden now are warning that they're really being pushed to the limit. Nurses are talking about how they have to treat patients in the waiting rooms because they don't have enough space in the hospitals. And it's not a question if they will be doing extra shifts, it's a question of how many extra shifts they will be doing. And it's really interesting to see the politicians' priority here. There is a hospital in Sollefteå. They actually recently shut down the maternity ward there in order to save $1.9 million. But at the same time, the government has just granted what is more or less an amnesty for 9,000 failed asylum seekers. They failed asylum application, they were supposed to be sent home, but the Swedish government has granted them to stay in Sweden anyways. And not only that, they're getting free college, all on taxpayers' money. And guess what the cost is for this? Taxpayers have to fork out a nice sweet sum of $343 million so that these 9,000 asylum seekers who were failed asylum seekers are supposed to be sent home, but they get to stay anyway. And now the Swedish taxpayer has to hand out $343 million so they can go to college. Meanwhile, they're closing down maternity wards at hospitals just to save $2 million. You know, it kind of seems like the priorities are kind of a little bit wrong here, you know. That amount of money, 343 million, that is going to cost to give these migrants college, you know, it would have been much better spent to, you know, maybe use the money to build schools in Afghanistan or in Africa. They could help a lot more children that way than to give these people schooling in Sweden. But let's get to the point of this video. The Swedish Minister for Social Security, Annika Strandhäll, has said that this big problem that they're having in Sweden now with the healthcare has nothing to do with migration. In fact, the Swedish newspaper Aftonbladet, many of its readers have told them and complained that they think it's migration that has to do with this healthcare crisis in Sweden right now. But Annika Strandhäll says no. And instead she blames the elderly, saying, quote, "We have a quickly growing elderly population in Sweden." And so she says that she's blaming the elderly Swedish people for the problem with the healthcare crisis in Sweden, and she says that migration has nothing to do with it. You know, for my part, I really don't care what the reason is. When you have the world's highest taxes, you expect that they should be able to give you some excellent healthcare, you know? But no, apparently not. Well, thank you so much for watching this video, guys. If you enjoyed this, please remember to leave a like, hit the subscribe button, and make sure to hit the notification bell to get notifications whenever new videos come out. And please consider supporting my work as well on Patreon. It's highly appreciated and much needed. I'll leave links to my Patreon in the description below. And if you support me with $5 per month or more, you get exclusive access to my new Discord server. So thank you so much, guys, and I'll see you later.